Well, if you are tired of seeing a tired face when you look in the mirror, my first guest is here to help. I recently sat down with certified plastic surgeon Dr. Timothy Treese to talk about facial rejuvenation. In layman's terms, getting back your youthful appearance. When you come into Columbus Aesthetic and Plastic Surgery, he says the options run the gamut. I am here at the Easton office of Columbus Aesthetic and Plastic Surgery. I'm joined by Dr. Timothy Treese. So thanks for being with me, Dr. Treese.
It's my pleasure, Robin.
Today we are talking about facial rejuvenation. Most people first think of maybe a facelift, right? Is that kind of the basic term for all of this?
That's a term that it gets used the most, but facial rejuvenation really means a lot more than that. When we talk about facial rejuvenation, I talk to my patients about three main areas. As time passes, we lose a little elasticity in our skin, we get some fine lines, we lose a little volume, and we have a little bit of architectural descent of our natural tissues. So I talk about optimizing skincare, a little volume replacement, and then we also talk about the classic facelift.
And things have come a long way in that world, haven't they?
They have. You know, I just returned from Montreal. I was privileged to be with the best people in the world. And it's interesting when you see how many different techniques there are and how much has changed in the 20 years I've been doing this. But there are a myriad of different techniques, and they are all applied to slightly different situations.
And let's talk about some of the new names. You'll hear Quick Lift. That's one of those. What exactly is that?
Well, there are different proprietary lifts that are out there. There's the lifestyle lift, the quick lift, and then there are custom facelifts. So rather than go into the details of what some of these techniques are, I'd rather encourage my patients to go seek a board-certified plastic surgeon that takes a look at them and their uniqueness and then applies a variation of techniques that are perfect for their situation. Cookie cutter techniques are not best for patients. And the lifestyle lift and quick lift have gotten a lot of press. They're well marketed, but a patient really needs to go to a qualified board-certified plastic surgeon and have a technique that is usually an amalgamation of different techniques that's applied to their beautiful but unique face.
And that's the thing about you mentioning custom facelift. It's almost as if every single facelift should be custom.
Absolutely. There is science. There's the science of understanding the anatomy and the technique. And then on top of that, there's the wonderful art of applying that science in a way that is most aesthetically pleasing for an individual.
So if somebody comes in, they sit down, they talk with a board-certified plastic surgeon, they decide, this is the facelift for me. Are there anything, any risks they should be aware of, anything that they should know prior to coming in and making this decision?
Oh, absolutely. And we want to take care of people that are in reasonable health, but we all look at risk-benefit ratios, especially in doing elective surgery. If a patient's on a blood thinner or if they have a significant heart disease, I mean, there are things that we look at to make sure that they're safe. And again, this is all part of that really careful decision-making process.
Let's talk age, because I feel younger and younger, sometimes people think they need to kind of get ahead of that age progression that happens. A facelift probably isn't something you should do in your 20s, is it?
No, but there are a lot of things you can do early to sort of slow the process. So it's interesting because I see a lot of people in their 20s, but we see them, what we do is we maybe do a little submental lipo if they've got a real full chin, or most commonly we get them on a good skincare program, which delays the aging process. And so the average facelift patient is really 51 in our country. But we're doing a lot earlier to sort of minimize a bigger procedure later. And it's all about having people look and feel their best at whatever age they are.
Dr. Treese, what is the best way for somebody to reach you, to reach your office, to set up a consult and get this started?
Well, just call Columbus Aesthetic Plastic Surgery, and the number is 614-246-6900, or check our website, columbusplasticsurgery.com.
All right. Thank you so much, Dr. Treese.
My pleasure.